everyone. My name is Bonnie Lipton-Boss. I'm the manager at the UPI Health and Wellness Center. We're located in the Murphy Center, just right above the bookstore. And we have some volunteer opportunities. In case you don't know about us, our mission is to provide accessible, comprehensive, and compassionate healthcare services to our entire campus community. So we serve students, faculty and staff, as well as the family members, dependent children and spouses and partners of faculty and staff. And we really focus on promoting physical, mental, and emotional well-being. We take a team-based approach to healthcare. So we have multiple healthcare practitioners at our clinic, and all the services at the Health and Wellness Center are confidential, and we want to make sure that it's a welcoming, inclusive environment to meet the diverse needs of everyone who works and studies here. A little bit more about us. So we focus on whole person care. That means we care about all parts of you, and we want to make sure that we're supporting you to promote your health, prevent illness, and then if you've got ongoing chronic health conditions, to help support the management of those. Our team has licensed practical nurses. We have registered nurse. We have nurse practitioners. We have a family physician, and then we have specialist providers that come on campus to provide services to students. So we have a visiting psychiatrist who comes monthly and a dental hygienist who comes twice monthly to do dental hygiene for students. And we're super proud that we are the first standalone university health center in Canada to be accredited through Accreditation Canada. So quality really matters to us, and we're constantly trying to work on improving our services, and looking at access as well as the types of services we provide, and how we engage patients in supporting our ongoing journey to be better. And we're basically a standard primary care clinic, and that means we're like your doctor's office on campus. We offer so many services. I've just like kind of picked a few that are like the most popular, but basically like your sore throats, your sore ear, your sniffles, all that stuff. We're gonna see you. Prescription renewals. We do immunizations and injections. We do blood work right here. So if you need blood work, whether that be your practitioner ordered it here at the clinic, or if you've got a family doctor in the community and they order blood work, you can get that drawn here. We actually are doing our flu clinics today and tomorrow in the Murphy Student Center, and then next week in ABC. So you can get your flu and COVID immunization right here on campus. We support mental health care. We do ADHD assessment and management. So we have a nurse practitioner who specializes in ADHD. We provide gender affirming care, and then we've got lots of sexual health services. You have any questions about sexual health, we can pretty much do it all. And then we do lots more, but those are the most common services that are accessed. And like I said before, all your services here at the Health and Wellness Center are completely confidential. Your healthcare information is private and confidential. Nobody else on campus has access to that except your healthcare team here at the center. So we have been working really hard. We just finished our accreditation last winter, and we've been on quite a journey to consider how we provide care to our campus community and how we can do a better job. And with students, I mean, it's been a little while since I've been a student. I know you can't tell, but it's been a few years, and I actually don't know kind of what's going on in your world, and like how we reach you, and what are the things you care about, and what are the things you stop and listen to, or what do you think? What are the things you want us to be talking to you about? And so we've just started this fall dipping our toe into the volunteer world. So we started with our flu flu and COVID and Men B clinics. So those are happening right now. And so we've got different volunteer opportunities for our clinics. In a health, if you're in a health program, those might be of real interest to you. We have clinic navigators, and then we have post-vaccination recovery observation. And so those are opportunities that are past for now, but will come around again next fall. And then we've really realized that we don't know how to talk to you. And what I mean by that is that if we want to talk to you about the new drinking guidelines, or if we want to talk to you about how to keep yourself safe in your relationships and how to protect yourself from STIs, or if we want to reach out and connect with you about opportunities to engage in health promotions type stuff. We don't actually know what are the things that you're worried about or that you care about or that you want to learn more about, and what are the ways that we can actually make a meaningful connection with you. Like, should we set up a booth in the library, or should we come around to the residences, or should we be at the gym, or like what should we be doing? And we know that we also don't know how to market. I'm not saying like we are the worst, but we could be better. And so, we have like aspirational dreams of having a social media account. And we feel like students are way, way better at that than us. So we've got these dreams that we will be doing more health promotion to talk to you about sleep, to talk to you about how to take care of your mental health, how to consider your relationship with substances, and how to keep yourself safe while being sexually active. And like other things too. But we really need students to help us figure out how we message that, what channels we use, what are the best ways to engage? And we think that students talking to students is pretty powerful. And so we're creating a list for future events so that we can start to kind of look at how we might engage student volunteers to help us with some of the opportunities that we want to do better in. So health promotion, marketing and communications, and then operations support. We have a full-time student who works with us. She started this summer and she just did an AI workshop for our entire team. And I'm like maybe embarrassed to say, but not ashamed to say that like we all learned so much and she kind of blew our minds. And I feel like we're going to be so much better just from this one workshop from a student. So we see you as experts and we need your lived experience and your expertise. Like, we can't do it without you, quite frankly. We're going to keep doing the same old things over and over and over again. And I want to protect trees. Like, let's save some trees and stop printing things off that people don't read or put in the garbage. So we think that you're going to give us better ideas and you're going to help us do it better than we could do it. So basically at the end, if you're interested in like getting onto our list, you can send us an email. And then most importantly, and I'm checking my time. Okay, I have like 1 minute. We have a new patient advisory committee, and this is for patients. So if you've accessed the Health and Wellness Center, even just once, we are recruiting faculty, staff, and students to help us improve the care at the Health and Wellness Center. Patient advisory committees are a really common thing in healthcare, and basically it makes sure that how we plan our services, how we deliver our services, how we evaluate our services, that patients are helping to direct that and keeping us like on the right track, really. So we're looking for students to represent the voice in health and wellness planning. We want you to share your ideas and feedback. How can we make our services more accessible and inclusive? What are the barriers? And help us come up with solutions. Help us evaluate, like, even our patient satisfaction survey. I don't even know that we ask the right questions. Help us figure out what questions we should be asking. Look at our protocols. Like, if there's things that we could be doing more efficiently so it's easier for patients, we want you to come and help us be better. And so if you want to be part of a solution-focused team, we're accepting applications because we can't have a giant committee. The deadline for applications is October 30th. It's a really, really easy application. It's like 4 or 5 questions. And the QR code is there. So if you're interested, scan this QR code. You're going to get a certificate of completion. It's a 1-year commitment. That commitment goes till May of 2026. And you'll get a certificate of completion. We're going to have 4 meetings, and you'll get snacks, and but you'll get to connect and collaborate with faculty, staff, and students from across campus. And you're part of a team to make healthcare services better on campus, and for us to really practice what we like aspire to, which is to be inclusive and supportive to our entire campus community. So, and just like a little plug for all of us who are seeking volunteers, you know what? Volunteering activates the happiness chemicals in your brain. It boosts your mood, your motivation, your sense of connection. And when you're helping others, or you're being creative, or you're working in a team, you're not just making a difference for all of us who are seeking volunteers, you're also supporting your own mental well-being. So feel good while doing good. It's like a double benefit. That's my pitch anyway. So if you're interested and you want to learn more about any of our volunteer opportunities, or you want to sign up for our volunteer list, this is the email, hwcconnect@upei.ca. Send us an email there. Or I guess this will be available, so you can always scan the QR code or come into the Health and Wellness Center and chat with us. Anyway, thanks.
Thanks so much, Bonnie. That was awesome. We'll kind of open things up. If anybody has any questions, feel free to raise your hand or type it in the chat. Okay, we did get one question there, which is it open only for UPEI students or recent grads eligible as well?
This is a great question that I have not put any thought into. Honestly, like I think for the patient advisory committee, it has to be current students who are patients at our clinic. But for the other opportunities, I would never want to say no to a volunteer. I mean, I'd be so grateful for any volunteers. So for our patient advisory committee, it would just be limited to current patients. So you have to be a current student. But if the other opportunities are interesting to you, send us an email. We'll talk about it.
That's awesome.